be in full support of a voluntary counseling and testing option instead. And indeed, voluntary counseling and testing is also in place and is being enforced by the Ministry of Health. So that is a good thing. And with the premarital HIV testing, another issue of concern is confidentiality of the results. Because in policy, it is easy to say that the results of the testing is confidential. But on the ground, in operation, in practice, that is very difficult to monitor, especially in the rural settings where premarital counseling are done within the community itself, within the local religious authorities. So that is still an issue that Malaysia is struggling with and trying to come up with a good balance for now. Next, please. Workplace policies, we have quite good guidelines from the Department of Human Resource and Department of Occupational Safety and Health in terms of legal issues relating to workplace policies, and a lot of these are based on the International Labour Organization Code of Practice and guidelines. However, the issue really is compliance and enforcement. Whether or not companies and employers are putting the policies in place is not being monitored quite well. And there are several issues based on dismissal on the basis of HIV zero status, the fact that some companies are doing pre-employment HIV testing, which should not be done, and also with regards to employees' benefits and entitlements if they are found to be HIV positive. The Malaysian AIDS Council has formed a Malaysian Business Coalition on AIDS, the MBCA, and hopefully they are going to get more proactive in addressing these issues. Next, please. Media sensationalization of HIV as well as marginalized population issues. These are some newspaper clippings I received from a presentation slide from the MSM groups. And this is how homosexuality or gay venues are seen as a sensational newsworthy item. So whenever police do raids on these locations, they become big news, and it creates that further taboo and stigmatization within the general mainstream population. And the danger of this is it drives the MSM, the gay population, further underground and even poorer safe-sex behavior, which is a difficulty for us to do prevention efforts. Sometimes in the raids of MSM venues, for example, gay spas or massage saunas, sometimes the discovery of condoms at the venues are being taken as evidence of illegal sexual activities taking place. So that becomes almost like a detriment for the people to carry condoms on them. So again, that creates a difficulty for prevention. Next, please. Forms of stigmatization and discrimination faced by people living with HIV based on that earlier focus group discussion I mentioned, and includes a lot of things such as verbal insults, harassment, undignified death procedures. What I mean is the management of bodies of people living with HIV who died of AIDS. And also with things like people refusing to pray beside people who are living with HIV. So that creates a lot of sentiments, very sensitive issues for the community. Next, please. On the individual, impact on individuals and families range from emotional to psychological, social, physical, as well as financial. There's abandonment by family and friends, and in that sense, the Malaysian AIDS Council, with its partner organizations, are trying to create a stronger support network for people living with HIV, and also changes to personal relationships. There's that personal view of self-imposed restrictions on social interactions, where the people who are living with HIV themselves remove themselves from social interactions because of low self-esteem, because of this discrimination and stigma that they are faced with. Next, please. But key issue in terms of management of the epidemic, I mentioned some of this, is that marginalized populations become further hidden and the true nature of the epidemic becomes unknown, and it's a barrier to surveillance as well. And it creates poor reach and coverage of intervention measures, which is a real issue for Malaysia at the moment. At the top level, national policy decision making, discrimination and the mainstream view of the marginalized population creates misleading national strategies. We lose focus on what should be our target for national strategy, especially since Malaysia is identified as a concentrated HIV epidemic. So ideally, those should be our focus of intervention, but unfortunately, a lot of times it is not. So what is being done? Community empowerment is definitely on the increase in recent years. Malaysian AIDS Council, with its partner organizations such as the Pink Triangles Foundation, several shelter homes for people living with HIV and their families, they are creating better and stronger empowerment of community, not just people living with HIV, but also other affected communities. There is increasing collaboration interdisciplinary between different government bodies, especially with the religious authorities, and that's a very significant step forward that we are looking at the moment. Media and community awareness is also one of our key response issues. A few years ago, UNICEF initiated a seminar for newspaper editors and reporters, sensitizing them to the issue of HIV and also the need for sensitive reporting with regards to key affected populations. Leadership support is of course very crucial. Next, please. Most recently, in 2009 World AIDS Memorial Day, the Malaysian AIDS Council did something which is quite a social breakthrough, in that it organized a memorial and forum event at the Malaysian Federal Mosque, and this was in collaboration with the Department of Islamic Development, and this is something that is a real breakthrough for us, and we hope that this can initiate further change in the future. Next, please. So the way forward for Malaysia, and I'm sure this is true for most countries in the region, is that we need to enforce increased education and awareness about HIV and AIDS, change the perception and societal norms, but at the same time be aware of mainstream sensitivities. Too strong activism and without expecting too much change from the mainstream society, it needs to be balanced with the nature of the country and the cultural norms. Advocacy and strategic responses need to be looked at properly, and communication is essential. Open dialogues and discussions from all levels of society will be good. So that's it from Malaysia. Thank you for everyone.
Thank you, Dr. Karina. Now we move to the last presentation from Indonesia.
Thank you. First of all, let me say that HIV/AIDS is not only the health problem.
I can't hear you. Hi, this is Malaysia, Monash. I can't hear you.
Sorry. Okay, thank you so much for this opportunity. First of all, let me say that HIV/AIDS not only the health problem, but also have direct impact on social and economic sector, as well as a human rights issue. As you know that the problem of HIV/AIDS, when we talk in the human rights perspective, have to guarantee the protection and fulfill all rights for all human beings. As a person who suffered HIV/AIDS, person living with HIV/AIDS, and also civil society. Concerning this condition, so talk about HIV/AIDS in human rights perspective, we must talk about the rights of person who suffered HIV/AIDS, the rights of person who living with HIV/AIDS, and the rights of the society. In one hand, the rights of person who suffered HIV/AIDS must be protected by state, But on other hand, the state also have obligation to protect the right of the society from transmission of HIV/AIDS. In my opinion, that one of the factors why the number of people who suffered HIV/AIDS increased rapidly because of the society never knows who suffered HIV/AIDS, who suffer person with HIV/AIDS. Actually, one of the efforts to prevent the transmission of HIV/AIDS is the need to get information on all things about the HIV/AIDS as well as person who suffered HIV/AIDS. But if we talk about them, they have right to keep their medical record as a privacy and do not care about the society. Ladies and gentlemen, in this time I would like to inform about the human rights principles because if we talk about the right of the person who suffered with HIV/AIDS, we must follow on a human rights principle. We have a number of human rights principles. First, equality, among others, universality, human dignity, non-discrimination, indivisibility, inalienability, interdependency, and responsibility. And then if we talk about the human rights violation, in the term of the HIV/AIDS, we found three kinds of the human rights violation. The first one is discrimination, the second one is stigmatization, and the third one, violence, human rights violence. So in the perspective of human rights, and based on the experience by Komnas HAM, we found three kinds of the human rights violation for the person who suffered HIV/AIDS. And then actually, if we talk about the principle of the anti-discrimination, we can follow on the article based on the Universal Declaration of Human Rights, Article 1, stipulated that all human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act toward one another in spirit of brotherhood. And we also found in the Article 2 that everyone is entitled to all the rights and freedoms set forth in this declaration without distinction of any kind, as well as I think for the person who suffered HIV/AIDS. Then actually if we talk about the human rights violation, a big number of human rights violation we found for the minority group and also vulnerable group. Stipulated in the ICCPR, International Covenant on Civil and Political Rights, the terminology of the minority group who are based on the religion, minority group based on the language, and minority group based on the culture. But on the other hand, we also have people, a group of the vulnerable. We call vulnerable group as well women, children, disabled, labor, person with suffer HIV/AIDS, and also LGBT group, lesbian, gay, bisex, and transgender. I think if we talk about the right of the LGBT person, so part of this we will also found the human rights violation with regard to HIV/AIDS. Then I would like to talk about our experience from our institution Indonesian National Commission on Human Rights, we have many cases with regard to the issue of the HIV/AIDS. This is cases handled by Komnas HAM from complaint from the society, individual society. So we found a number of the human rights violation for the in the issue of the HIV/AIDS. The first one, discrimination. This is issue of the discrimination for the people who suffered HIV/AIDS. The first one, about the education rights. We found a number human rights violation in this issue. For instance, discharge from their workplace, and also we call the victim of the human rights violation. They also discharged from their schools. I think in Indonesia, not yet, just a couple times ago, we found a case about the human rights violation for the HIV/AIDS in Medan. We found the student, I think he is 8 years old, and he also suffered HIV/AIDS, and he discharged from his schools. And also another case, a person of HIV/AIDS who recognized in their school to be dropped out. This is many cases, give their cases to Komnas HAM. And also another human rights violation about the discrimination in the social environment. In human treatment committed violation of law by the society as well as the apparatus, indecent processes of funeral, for instance. We found many number person with HIV/AIDS, when they die, so they have a different process of the funeral. The third issue of the discrimination for the person with HIV/AIDS with regard to the medical service. I think we know about it and already mentioned from the first speaker and also second speakers that discriminative attitude on medical treatment, especially in public hospitals. I don't know about it in the term of the situation in the future. Person of HIV who is hospitalized to be in charge for additional fee. We know medicine for the HIV/AIDS is very expensive. So, as also if medical person know about the victim, so they actually they need the additional fee for their health. Another issue of the discrimination in the media, I think. Clearly written in the media with complete name and address of person of HIV/AIDS. We found it in the many number of the newspaper and also media in Indonesia. If we talk about the issue of HIV/AIDS, they stipulated the complete name and address of person with HIV. Then this is issue of the stigmatization, follow with the issue for handling by Komnas HAM. Actually, we found many number stigmatization for the person with HIV/AIDS. The first one, bad image of person who suffered HIV/AIDS. We know about it, and I think everyone know about it. Sometimes people with HIV/AIDS call as nasty people, because person with HIV/AIDS sometimes related with regard to prostitute, and also related with drug user, and also for the person with HIV/AIDS, many person call about the dangerous people. And then the last presentation about the issue of the violence of human rights. So we found many number about the violence of human rights. The first one about the having bad treatment from society as well as family. So family sometimes also give bad treatment for the person with HIV/AIDS, and also isolation done by family. This is also part of the human rights violation. So we must fulfill their right to get their right, and also forced to live done by society. And the last one, actually they also get verbal abusement done by society. All of my presentation based on my experience, handled by Komnas HAM, gave from the society. They complain from the society to Komnas HAM, and now maybe follow for the function of the Komnas HAM. We will conduct two kind of the activity. The first one, Komnas HAM have function to conduct education and awareness to the society with regard the issue of HIV/AIDS, and the second one, Komnas HAM also have function to have study and research on issue of HIV/AIDS. I think this is all of my presentation. Thank you very much.
Okay, thank you, Ibu Hesti. We will start with the question and answers. We have three groups. The first group is University of Diponegoro, University of Airlangga, and Monash, Malaysia. The second group is University of Hasanuddin, the Philippines, and University of Gajah Mada. And the third group is University of Salemba, University of Indonesia at Salemba, and University of Indonesia at Depok. Let's start with the first group. University of Diponegoro, do you have any questions for the three speakers? Hello, University of Diponegoro. Hello. Okay, let's move to. Hello, University of Diponegoro. Do you have any questions for the speakers? Hello.
Okay, talking about the discrimination, I would like to ask you the question about the discrimination that's happened for the women, because we know that women is having so many problems when they have HIV/AIDS in their life. So what is the alternative of the solution to lose the stigmatization of the women with HIV/AIDS infection? Thank you very much.
Thank you, Undip. We move to University of Airlangga. University of Airlangga, do you have questions for the speakers?
Yes, Pak Isar, we have a question.
Okay, please.
Okay, Pak Isar, I am Briono from Department of Epidemiology, Airlangga University. My question is about the reported case in Malaysia, 50%. Yeah. How could they say that the prevalence, the reported cases 50%? Because I think if we remember about the iceberg phenomenon, I think the reported cases may be smaller than 50%. That's my first question. And my second question is to my friend from Malaysia too, about the premarital mandatory testing for Muslim couples. Too, they can tell about maybe a lot story about that. What happened after the test, maybe if positive or something like that. Thank you, Pak Isar.
Thank you, Pa. We move to Monash at Malaysia.
Yes, thank you. I would like to ask a question. Just now, to all these three speakers, let's say if the employer asks for a pre-employment check on his new employee on HIV testing, without which the employee cannot gain employment in the company, and the speakers are saying that this was actually a stigmatization. But what happened if, let's say, there was no pre-HIV testing on the employee then get employed into the company, and one of the other employee got infected somehow without any knowledge of this, and therefore what is the legal implication on the employer in such a situation?
Okay, thank you.
Thank you.
The first question, I think, is for the three speakers. The Philippines, would you respond to the first questions? But discrimination that does happen in women, and what is the solution? Thank you.
In the Philippines, what we are doing as far as women PLHIV is concerned, I think just recently they had been formed as a group, so that we call it Babae Plus. It's women positives. So they are now an active group, which is also part of the bigger organization of PLHIV, but they are actually being empowered at this point, so that they will also be more involved in the response or in the activities relating to formation, education, relating to project management, relating to advocacy. So these are some of the things that we're doing here in the Philippines as far as women PLHIV is concerned. Bobby would like to add something?
This Babae Plus, the support group of women here in the Philippines, they do also have this activity, which they invite the family of the women HIV positive for the process of disclosure, because some of these women positive who have children are not yet disclosed, so they are conducting this activity under the support of UNICEF. Okay, that's all.
Okay, thank you.
That's all.
Dr. Karina Razali, would you like to respond to the first question? Karina, do you still with us?
Yes, yes.
Yeah.
With regards to reducing efforts to reduce stigma among women with HIV in Malaysia, again, this is under the Malaysian AIDS Council, which has more than 40 partner organizations under its umbrella. There are quite a number of organizations that are dedicated to women issues specifically. Two in particular, which are the Wake organization and Rumah Soleha. These two are more with regards to the well-being and care and support for women with HIV and their dependents and children, whereas there are several others like AWAM, which is All Women's Action Society, that are more concerned with lobbying and advocacy for the rights of women in general. The Family Planning Association is also very active in Malaysia, so they manage that side of management efforts in terms of women with HIV. But there is also another level of vulnerability when we talk about women with HIV. For a subset of population where it is through spousal transmission, and often these are the spouses of injecting drug users and or clients of female sex workers, the spouses when the spouse is also HIV positive and the death of the husband results in the female HIV positive person, the wife being the main caregiver for the family, that is also an issue beyond stigma and discrimination. Thank you.
Okay, thank you. Sorry we lost your video. Ibu Esti, you would like to respond to the first questions?
Actually, for Komnas HAM, we don't have experience about it, but if we follow with the function of Komnas HAM, maybe we can give the how to strengthen the position of the women to in the family, and also how to give awareness to women to know about the issue of HIV/AIDS and how to have a knowledge about the issue of HIV/AIDS. So we must follow with Komnas HAM function two things. I think we must